the time. Welcome to City Club of Eugene, January 28th, 2022 program. We're glad you've joined us. This is the 18th program in our 2021-22 programming year. My name is Kitty Piercy, and I'm the City Club President. Support for the City Club is provided by our members and sponsors. You can become a member of City Club at our website. This program is live streamed and taped. Our programs are always available on our YouTube channel and our Facebook page, and our podcast is available wherever you listen to podcasts. Programs are broadcast on public radio station KLCC 89.7 on Monday nights at 7. We have both business and in-kind sponsors. Our diamond sponsors are Kaiser Permanente, University of Oregon, Peace Health, and Lane Community College. And we get generous support from the City of Eugene and from Lane County. Our format today includes a question and answer period with City Club members and non-members alike via live stream and text. The number to text is on the banner on your screen. Speakers for today's program, which is called Collaborating on Permanent Housing Solutions, are Michelle Hankey, CEO of Shelter Care, Debbie Farr, Manager of Community Relations, Trillium Health Plan, Jacob Fox, Executive Director of Homes for Good, Sarai Johnson, Housing and Shelter I'm going to trip over this, strategist, Lane County and Eugene. Biographical information on our speakers is available on our website, cityclubofeugene.org. I'd like to thank Mary Layton for coordinating today's program. Supporting people who need affordable, safe, and permanent housing requires coordinating several kinds of community resources, and that is a reoccurring challenge. Sometimes special services are required to allow people to live as independently as possible. Abundant evidence shows that providing effective support increases stability and reduces long-range costs for all concerned. But providers are also often funded by sources with restrictions on how money can be spent. And sometimes their individual missions are defined too narrowly to offer all the help needed. Working together is the answer. In this program, representatives from several local agencies, public and private, will describe for you how they collaborate in projects that provide both shelter and services to the region's most vulnerable people. Michelle Hankey's Chief Executive Officer of Shelter Care is today's moderator. Michelle will manage the presentations and introduce herself and the other speakers. Michelle, welcome.
It's so odd to take a mask off. Give me one moment while I move us to the beginning of our slideshow. There we go. And the slides are more for your assistance as opposed to having to read them all. So, Shelter Care provides compassionate housing and behavioral health services for individuals wanting a safe and stable home in our community. We have a vision that everyone will have the chance to achieve their highest level of independence and resilience, recognizing that those levels are not going to be the same for everyone at any given time. Our programs include homeless prevention to keep people housed through activities like rent and utility assistance, and behavioral health care for those with severe and profound mental illness diagnoses like schizophrenia. That is Shelter Care's niche in the behavioral health world. People can stay housed if they have the support to keep themselves mentally healthy, and other ways too. We also have rapid rehousing and diversion outreach for those who are newly unhoused. Now, while shelter care does not do emergency housing, that is not our niche, of course we work with others to make sure we're reaching the individuals who can use our services. We do provide transitional housing for those who are almost there, who are getting a plan, who need a little space for 6 months to 2 years as that plan works itself into a more permanent solution. One of those being our Medical Respite program that helps people who are coming out of the hospital. They are unhoused, but we want to not have recidivism back into the emergency room. We want to make sure that they have time to heal, and that is our SMR program. And of course, we have our permanent supportive housing program. And these programs are long-term housing solutions for our chronically homeless in the community. Several agencies in the community do this kind of program, and each of us have a specific niche of the population that we serve best. Shelter Care's niche is working with those with mental illness or other severe trauma. Permanent supportive housing, or PSH, so that we can spell it better when we're typing, are programs that follow a philosophy of housing first. And that's in order to address goals like finding employment, education, attaining education, getting clean and sober. Whatever those goals are, people really need to be in a safe place in order to address those goals. Imagine if you had pneumonia and you were trying to recover from pneumonia in a tent. Just as an example, you may not be aware that the person living next door to you is a participant in one of our programs or in one of our peer agencies programs. Some residents have leases that they own out of their own names. Others participate in a master lease program, which is like subletting, with Shelter Care owning the lease, working directly with the landlords, and we can place people in who might not be able to hold a lease yet in their name because they need to have that history of a credit check, or they need to work on some things, and we know that we can support them better through the master lease. And so we work with multiple landlords through that master lease program as well. This is useful when a client, oh, whoops, I already did that. Shelter Care staff continue to provide case management as the client increases skills, income, and a history of success in becoming a good tenant. I do have a few myths to debunk. Participants pay rent. It's not free. They pay 30% of their income, and many of our participants have work. They may have disabilities. Their income comes in many different ways. The renters are held accountable, just like any other renter, for upholding lease agreements with their behaviors. There are times when a person, due to those behaviors or poor choices, may be evicted from a unit. But we follow a philosophy of care that recovery is a process. Just like any 12-step program, people can have bad days and backslide, make mistakes, and have to start again. You might expect a person trying to quit smoking to have days when they backslide and might need to start again. Recovery from other barriers, such as mental illness, addiction, etc., will also have failures that require trying again. We know that our participants learn from those evictions and working with a case manager to correct that behavior and are successful on their next try. I can tell you lots of stories, but I don't have enough time. Harm reduction in recovery recognizes that no one magically becomes perfect overnight. It takes steps to attain those goals. And those steps may, again, not be perfect, but they're on the right trajectory. Here's an example you might use. If a person has been living chronically homeless for many years, and they're given a unit, and they're working in a unit, at first they may not feel safe sleeping in a bed. So they may sleep on the floor, and then they may sleep in a sleeping bag, and then they may sleep on a mattress on the floor until they're ready to take the next step into a regular bed. Now that, of course, is a very simple example, but it's one you can see. And most important, one size does not fit all. Every single person needs to be seen as an individual with their own set of strengths, weaknesses, and traumas, with goals and program plans catered to fit their needs. And here's where collaboration is so important. With so many individuals, that means shelter care has a wide range of collaborative partners to get those specific resources needed for specific clients. Our case managers help our program participants navigate around these resources. We don't do things for our program participants. We work side by side to help them become resilient and independent. And if we did everything for them, we wouldn't be helping them. Whether it's resource for employment, childcare, transportation, or education, finding affordable housing, or applying for a better fit of housing like adult foster care, or in getting them connected to the vital health services they need for wellness. Shelter Care's behavioral health team, again, does not cater to addiction services. We work with severe and profound mental illness. So we partner with Chrysalis at Whitebird, for example. And our most important partners in healthcare are our local CCOs. And so I am so glad that I am able to introduce Debbie Farr, who is Manager Community Relations for Trillium Community Health Plan, and she also represents Trillium on the Lane County Poverty and Homeless Board, which also collaborates with Shelter Care and other agencies to ensure access to health care and behavioral health care for individuals experiencing homelessness. Debbie. Don't trip.
Navigating in this new post-COVID world is interesting. And Michelle, I think you might have also taken my notes. I'm not positive I need the notes. I think I can do it without them. But it might be a good, thank you. It might be good to have them just in case. I have slides because I want to make sure that I don't take more time than is allotted to me. So thank you, Michelle. I love the name of my part of the presentation, Housing is Healthcare, because that's absolutely true. CCOs were conceived in, well, they were launched, I should say, in 2012. They were conceived before that by the Oregon legislature. The Oregon Health Plan actually started with an 1115 waiver in 1994. CCOs received a waiver in 2012 that allowed them to offer health care in a new, transformative, innovative way. So one of the things that CCOs were required to do was to achieve better access to care, improve the health of the community, while also investing in the social determinants of health, like housing, food, and transportation, with the expectation that it would reduce overall costs, and some of that cost savings could be reinvested in the healthcare system. So it probably doesn't surprise anyone here to know that social determinants of health account for about 80% of an individual's overall health, with medical care accounting for about 20%. The 1115 waiver allowed CCOs to create what we call health-related services. And those are benefits that are not covered by the Oregon Health Plan, but are just as important to overall health. Trillium collaborates with local organizations like Shelter Care to offer innovative programs that provide access to housing. And I'm going to talk about one of those programs right now. Michelle gave you a little teaser. It's called the Medical Respite, or the Medical Recuperation Program. It started as a pilot project in 2015 with Shelter Care and Peace Health, and it was paid for by a Trillium Transformation Grant. Discharge planners at River Bend work with Trillium care coordinators to secure respite housing at Shelter Care while an unhoused person is recovering from an illness or an injury. And I don't think it surprises anyone in this room to know that it's pretty difficult to recover from an illness or injury if you don't have safe, supportive housing to live in. So here's just a few stats. So Trillium did an analysis, and we saw that the per member per month costs increased by 11% during our medical respite members' stay at Shelter Care. And then we contrasted that with a comparison group. These were individuals not participating in the program, whose costs increased by 33% post-discharge. So that suggests a possible savings right there of $728 per member per month. What we also noticed was that PCP visits, medical transportation, non-emergent, pharmacy prescriptions, all increased more for the shelter care members. And what that told us was that shelter care was providing effective support, like Michelle talked about, also with the help of our community health workers and case managers, who sometimes had never, they didn't even know about that Trillium member. They had never interacted with them. But being able to meet them where they are, they were able to provide resources around their health care, yes, because many of them weren't engaging in their health care, but also other resources like possibly permanent supportive housing. When they leave after 30 to 60 days, there isn't probably going to be housing for them to transition to, but our care coordinators, our case managers can help connect them to housing supports for the future. So now I'm going to talk about the frequent user system engagement programs. So I just talked about respite housing, temporary. This is permanent supportive housing. The FUSE program, and I probably should read from my notes instead of reading what's on the slide. That can get a little bit boring. The FUSE program began in 2017 as a collaboration between Trillium and Lane County. FUSE provides housing and other resources to the highest utilizers of the public safety and healthcare system. And it improves health outcomes while at the same time reducing costs. So I'm going to show you another analysis that Trillium did in 2017. And what we learned was there was a decrease in emergency room usage of 26% for FUSE participants, a 55% decrease in hospital inpatient stays, a 14% decrease in behavioral health care utilization, and that's primarily because this was a small sample size and there were a couple of participants who had constant involvement with crisis services, and 53% decrease in overall healthcare costs. So it was estimated that because of the healthcare cost savings and because of a decreased interaction with law enforcement and crisis services, that the community saved up to $28,500 per FUSE participant. So that's money, again, that can be put back in the healthcare system and that can be invested in other programs like the Commons on MLK. So because of Trillium's involvement with the FUSE program, we were one of the first healthcare organizations to recognize the need for permanent supportive housing and to pledge an investment along later with other healthcare partners. And we were able to invest $500,000. I also want to acknowledge that while Trillium was the first CCO who started serving Oregon Health Plan members in 2012, in 2020, Pacific Source joined us in the service area, and I am proud to collaborate with them on these programs. So some former Trillium members are now Pacific Source members, and because of Pacific Source's commitment, they still have the same services with Medical Respite and the FUSE program. So without further ado, I am going to turn the presentation over to my colleague Jacob Fox, and also proud to work with Jacob on the Poverty and Homelessness Board and work with him because he's a member of our Trillium board as well.
Great. Thanks, thanks, Debbie, for the kind words. I'm going to just quickly switch gears on the slides. Okay.
Coming up on this?
No, it's okay.
It's stuck on Trillium.
Okay, that's fine. All right, so again, thanks, Debbie and Michelle. I'm Jacob Fox. I'm the Executive Director of Homes for Good, and it's just a real honor to be here today talking about what we at Homes for Good consider a human right, a basic human right. And kind of at Homes for Good, what we believe is that at the federal, state, and local level, there's plenty of money in our economy so that every person in America should be able to have a home. Are you going to help me?
Push this up just a little closer to your
Okay,
mouth.
great.
Try and stay close to it.
Okay, sounds good. So you can't see my slides, but really at Homes for Good, and I know with the partners we work with, it's all about people. It's about human beings. It's not about buildings. It's not about services, property management. It's about really like leaning into our fellow human beings, especially folks that are really, really challenged and sick and need support. So to keep me on track, I'm going to move ahead. So Homes for Good has definitely done a lot of permanent supportive housing over the years. And just to give you a couple examples outside of what we're doing in partnership with Lane County and the city of Eugene right now, we recently built 4 tiny homes for veterans experiencing homelessness in Cottage Grove. The Market District Commons at 6th and Oak, we've set aside 15 units for veterans experiencing homelessness and people with disabilities. So what I want folks to know is, like, this is not new. PSH exists in the community, but what I'm going to talk about today is buildings that are purpose-built for people experiencing chronic homelessness. That includes individuals and families. And the work we're doing is driven by investment from the city of Eugene and Lane County in both the building of those apartment communities and the ongoing operations as well. So the first dedicated permanent supportive housing building is the Commons on MLK. We opened it up in January of 2021. And the second building that we completed is the Keystone. That's at 13th and Tyler, adjacent to the fairgrounds. That's 15 units set aside for chronically homeless families. And then we have the Nell, which is on 11th and Charnelton. That'll be complete this coming summer, and that's 45 units for individuals experiencing homelessness. Within the walls of these apartment communities, there's a lot of supportive services. At the Commons on MLK and the Keystone, we're honored that Shelter Care agreed to be our supportive services provider. But just to give you a sense of some of the things that occur within those walls, we have to help people get ready and fill out like a bunch of government paperwork to get into the building, right? So pre-tenancy support. Obviously, once folks get there, there's ongoing case management. And there's a term we use that describes when you bring people into buildings that haven't lived together before, who've been chronically homeless for 5+ years. We call what happens there trauma collision. People that are chronically homeless are very ill in most cases. That could be physically, mentally, or both. So when you bring folks into a new building, you really have to lean in and provide a lot of support. Michelle talked about a lot of this, so I'll just kind of keep moving to give you some more information. So the Commons on MLK prioritized not only people that were chronically homeless, but frequent users of emergency systems in our community, emergency room, jail, as 2 examples. Everybody that lives in MLK received an assessment, and it's a vulnerability assessment with a huge acronym that I won't try to spell out. But essentially, the highest score on that vulnerability assessment is 16, and everyone at the Commons on MLK is between 14 and 16, so very vulnerable people. On average, everyone that lives there has been homeless for approximately 5 years. In the 180 days prior to moving into the Commons on MLK, the residents there visited emergency rooms an average of 9.3 times. They were in inpatient treatment for 13 days. And spent an average of 23 days in our local jail. So again, people were frequent users of emergency services. So that just gives you a little bit of background on the Commons on MLK. We've had 97 people referred since October of 2019. So that referral process is kind of a teamwork between Lane County and Shelter Care. 81% of the people have maintained their housing. And 50% of the people there have no violations or incidents that have been problematic in nature. I would say, I won't go through all this, but you know, people have had to leave the building. You know, I'm not standing before you saying it's like been easy or like, you know, everybody's been successful, because that would not be the truth. But you know, I talked about how ill people are. Just to give you an example, 4 people have passed away in the building over the last year. So moving on to monitoring my time as well. So the Keystone, again, that's 15 units for families that are experiencing chronic homelessness. On average, we have single parent households with 2 children. On average, they've been homeless for 2 years. Folks have extremely low or no income. There's folks that have chronic health conditions, a significant number, almost 50%, and 40% of the folks that live there report a history of domestic violence. I want to talk about the NEL briefly, and then just kind of talk about like the lessons we're learning and how we're kind of changing our approach based on the reality of managing these buildings. The NEL, as I mentioned earlier, we've already begun the partnership process, because that building will be complete this summer. Laurel Hill will be our supportive services partner at that apartment community, just so folks know. So in terms of lessons learned, the Commons on MLK is more expensive to operate than we anticipated. We've had to add staff to both property management and supportive services. The other thing that we've had to navigate is some significant number of floods. So there's been some damage to the building. So those are some of the things that have cost extra funding. The referral process also slow, and we don't start receiving rent assistance until someone's actually in the unit. So that's another sort of financial pressure point. During COVID, it's been super intense to have stabilized staff and a stabilized resident base. Many people that have worked there have gotten very sick. And folks that live there have gotten sick as well, which has made staffing challenge. I mentioned earlier, like I'm a bureaucrat, but there's a lot of paperwork, so we really need to, try to streamline the paperwork process. We need to work more closely with our emergency responders. With that, I'm noticing I'm at time. It's a community that we work within. Sarai is our shelter and housing strategist for Lane County. And we need to always work hard, but we also need to be fun and kind to each other. And that's one of the things I really appreciate about Sarai. So Sarai, come on up.
I failed to bring my timer up here, so I'm going to see if our moderator can give me a 2-minute warning. Oh, shoot. Okay, I got it. I can do this in 2 minutes. Whoop, whoop, whoop. Can you all hear me if I keep my mask on? Yes. Okay. I just don't know what the situation is underneath here. My face is very warm, so I'm enjoying that. Hello, I am Sarai Johnson. I do work for Lane County as the shelter and housing strategist, and until just a few weeks ago, I also worked for the city of Eugene and was the joint shelter and housing strategist. I still collaborate with the city, of course, and will continue working with them as a slightly different bent to my role emerges, really focusing more on the housing side of this equation, which I'm really looking forward to doing. We, of course, why I was brought on board to work for both the city and the county as the first joint employee of those organizations was to help implement these recommendations that you might might have heard of before that were given to Lane County and the City of Eugene by an organization called Technical Assistance Collaborative, or TAC. And so instead of saying Lane County Shelter Feasibility and Homelessness Systems Study, mostly we all just call it the TAC report. So there are these 10 recommendations in there. The city and the county came together to truly collaborate in a deeper way than they really ever have in the past, as far as I know, and as far as most of the leadership knows. And so we've had joint elected officials meetings quite a lot. Together, the City Council of Eugene and Lane County Board of Commissioners have adopted those recommendations and have been working toward implementing them since 2019. One of the big pieces of that is, of course, founding this work on that sense of collaboration between our local government agencies, where we have resources to put toward this, where we have expertise, where the continuum of care is housed, which is our HUD program for how to manage helping people get into housing who are experiencing homelessness. And so from that standpoint, a lot of the work that we've been doing is implementing different ways to run the continuum of care, while also adding shelter beds and permanent supportive housing units in partnership with Homes for Good. And so that work has all required bringing together the entire community. And I know that a couple of weeks ago, or maybe months ago, you had Brittany Quick-Warner here presenting about the Chamber of Commerce's response and interest in supporting efforts to get people housed and to end homelessness in our community, which has been a really great way for the private sector to start to get engaged with this project and the process of helping folks get housed. Those who need the most help, of course, are those who are hardest to serve, and that we have, all of our presenters have talked about already today. With this work, one of the big pieces has been learning how to hear from and create feedback loops for people in the community who are doing service provision for people experiencing homelessness, as well as prevention and housing, and listening to advocates and activists and those who are advocating on behalf of those folks who are experiencing homelessness as well. And that work has really helped us to hear more from the people who are closest to the ground on this work, from people who are experiencing homelessness currently or have in the past and have that lived experience expertise, and bringing those pieces of input to bear on that work. And a lot of the ways that we've been able to do that a little bit differently is having this sort of outside the service provision role, where we are able to sort of use that as a sounding board and as a place to innovate. So I'll end really quickly because I know we have Q&A time, but I do want to let you all know that part of this, to me, and to really everyone that's in this field together, is helping us all have a better understanding of the nature of housing and homelessness and the connection between those things, and to make sure that we're also able to test and try and innovate our way towards success. So lots of the things that we heard about today are examples of that, including Fuse and MLK Commons. We'll also be doing the same thing with our navigation center that will be opening up pretty soon this summer. Michelle?
So I believe it's a 5-minute break, and then we'll be doing a Q&A.
That's correct.
And
I just want to take a second to remind everybody, because it's such a spontaneous thing to kind of close in on each other when we take a break. So I just want to remind you to keep your social distancing to protect us all. We'll be back in 5 minutes.
We're going to do some Q&A around housing, permanent supportive housing collaboration. And I believe we have our first question.
Hi, my name is Tanner Brereton, and I'm a City Club member. This one's actually a little closer. All right.
There we go.
My name is Tanner Brereton, and I'm a City Club member. This is actually coming in from the live stream. This person asked, I am wondering if anyone on the panel knows if Eugene has reduced the number of homeless people in the past few years, or are we constantly lagging behind? Thank you for all you do. I hope that it's making a significant difference.
Hello, it's me, Sarai, and I can gladly answer that question. One of the ways that we've shifted and made our information better over the last few years is moving away from using what's called the point-in-time count that's conducted once a year to as a snapshot of what's going on around homelessness in the city and the county at large. And we've moved into something called the homeless by name list, which is a more up-to-date and continuous moving picture of what it looks like day to day. So from that information, which the first full year on that was 2019, we do see slight differences in the number of people who are appearing on that list year over year. So in 2019, it was about 9,600 people, close to 9,700. The year after that was a little closer to 9,200. And you know what is weird? I actually haven't looked at the final count for 2021 yet, but once I do, I'll be able to tell you confidently about that. What I also can tell you is that every year from 2012 on, you can find this on the county website if you're like really good at Googling, is all of the PIT counts, the point in time counts since 2012, and each of those also has an unduplicated count of people pulled from the homeless management information system. So in lots of those years, we had over 10,000 people experiencing homelessness, 15,000 one year, and so our unduplicated count, that 9,000 number I mentioned, is a little bit lower than it had been in the past and is a more accurate way for us to do this count. Any given month, we have between 2,500 to 4,500 who are experiencing homelessness and receiving services from those who are participating in the homeless management information system. So we do know that that number is relatively consistent, but over the last couple of years, we have seen a slight decline in the overall number.
Perfect. And then I personally have a second question. So this is mostly at shelter care, but also for Trillium and Homes for Good as well. So is the process of being in these programs voluntary? Can they leave at any time?
So no one has programs forced upon them. That causes trauma, and no one can be successful unless it's a partnership between the person who has the goal, their case manager, their service provider. So the way they get into the housing programs, per se, is we have one coordinated entry list for the whole county. And while, of course, nothing is perfect, what this stops is having someone have to go to shelter care, to the next agency, and maybe we're all working on it and duplicating services inadvertently. What they do is they do a front door assessment. The county has that list and says, okay, and when shelter care has an opening, we reach out to the county and say, our Sahaley program has an opening. Well, these are the people who are appropriate for the Sahaley program. They send us whatever contact information is available because, again, remember, these are individuals who are sometimes hard to track down, and my staff find them and work with them. But again, it is voluntary. So no one is forced to do it because you cannot be successful when someone makes you do something. We want success. Anyone want to add to that?
Well, I'll just add that because you included Trillium in that question, so while it, like you said, or like Michelle said, they might be offered the opportunity to participate in the program, it's not mandatory. And for a variety of reasons, someone may choose not to live in supportive housing, you know, because they've suffered trauma, they, you know, have just had bad experiences. So again, yeah, it's something that we hope people will choose, and we're happy to help them do it.
Thank you. Any other questions? Yes, thank you.
Hi there, Karin Knudsen, City Club President-elect and member. Delighted to have you all here with us today. I'm also the founding director of Better Housing Together and know so many of you through that work. Thank you for all that you do in our community. I was struck by your comments and thinking really about the continuum of housing needs that we have in our community. Everything from emergency shelter through, home ownership options, the diversity of those needs, and also the value of the partnership that you're modeling. And that when we talk about people falling between the cracks or slipping between the cracks, really what we're talking about is a lack of connection between the resources and the people working in our community. So thank you for that. But you also spoke, I think, about urgency. And I'm wondering if you could offer us a bit more insight to that. Do you think we are at a time right now in our community when we need to spend 1 or 2 or 3 or 5 more years planning before we take action? Or are there actions that we have right in front of us serving that whole continuum that we should get to? Can you share your thoughts?
Who wants to go first?
We should always be good at planning, but not at the expense of getting things done. Karin, as you know, and this number's not quite perfect, but over the past decade, there's been something like 40,000 households per year moving into Oregon, and the number of units being built is somewhere in the 20s. So year over year, we have a huge supply side deficit at all income levels, and the people that are pushed out of housing are people with very low incomes. So it is time to act, as I said, at Homes for Good, and I can't speak for my panelists, but we believe housing is a human right. And like I said before, there's plenty of money at the federal, state, and local government level to provide a home to everyone that needs it.
And this is Michelle from Shelter Care. I'm going to jump in with what Jacob said. There's a phrase we use, and it's housing is health care. If we wait another 5 years, how many more people will die? I mean, let's really make it blunt. We had 4 individuals pass away at MLK because they were so delicate. They really were amazing people with great stories, and we lost them because of the trauma, physical, that they had to do. People die. We can't wait.
Thank you.
I should have said someone else. Hi, Brittany. Thank you for joining us.
Hi, everyone. Brittany Quick-Warner, President and CEO of the Eugene Chamber. Thank you guys so much for this. I had the pleasure a couple weeks ago of coming to City Club to talk a little bit about this, and I have had the opportunity to sit down with each of you individually and ask you 100 questions, which informed our report that we kind of put out, trying to summarize some of this challenge for the community. One of the things that I feel like is sort of a glaring question, so 3,500 people on average in our homeless by name list on a monthly basis. We have about 900 units of shelter in some sort of form, permanent supportive, transitional, emergency shelter. That's a big gap. Our service providers are providing enormous service to the community, but I'm wondering about capacity. There's a gap there. How do we increase the number of people that we can serve to get them off the street? What are the capacity challenges you guys are facing? And is it a matter of you're maxed out, or you actually have capacity in some of your services? We have to figure out a way to get individuals into those services. That was 5 questions in one. I feel like it was pretty good effort.
I can start.
You start all it. Okay. Okay.
So in my opinion, the nonprofit provider network and Homes for Good's a little bit different. We're a quasi-government organization as a public housing authority. There is the capacity to grow, and there is the capacity to scale up quickly. But what's missing is that most of us are paid with like federal grants, many of which pass through Lane County. And those grants don't pay enough to have the kind of administrative staffing you need to be able to scale up quickly. So when you're scaling up programs, you have to have a robust accounting finance department. You have to have like compliance experts. Those all sit behind the people that are actually engaged with people in poverty in our community. So the solution is that there needs to be local or state funding that's layered onto those federal grants so that service providers are paid adequately and we can scale up. So once that solution is achieved, which I believe there's the political will to do that, you will see us being able to scale up much more quickly and aggressively than we can at the current time.
Capacity is my soapbox, my private soapbox. I have approximately 100 staff who work at shelter care. They are not paid their value. And it's not just me saying they're worth $1 million. They are. I mean that their wages would make you very sad. And we are a grant-funded organization, as Jacob said, and here's an example of what happens. We get a 3-year grant through HUD. There's no COLA in there. There's no growth in that grant from those 3 years when rents increase. So if you run a business, that does not work. It just doesn't. And nonprofits, we haven't been good about saying to everybody, pay us what we're worth. Pay us our value. Our individuals work miracles. And I'm going to go on and then you'd cut me off. So I'm not going to do that. But I do want to say that from a capacity standpoint, you hear about teachers. You're hearing about the healthcare industry. You're hearing about that. Social workers, we are exhausted. We are just exhausted. The pandemic has exacerbated something that was already there. We were already tired. This has just made us more exhausted, and my staff need to be paid livable wages. I should not have to worry about how they pay rent as we help other people pay their rent. And
yeah, so, and I just also want to add that there is a tremendous mental health provider workforce shortage right now. And you can't open up an additional shelter without those services. You have to have someone on staff that's managing all of the behavioral health needs of the residents that live there. You know, there would be a lot of easy solutions if not for some of those things that we have to make it work.
Oh, I have this one. Hi, this is Sarai. I'm sorry. Since you asked 5 questions at once, I thought maybe all 4 of us should try to answer. But I want to address the part about the shelter bed capacity. It absolutely has everything to do with what everyone else has said around the capacity of staff, the ability for them to pay, the ability for organizations who are small and serving niche needs that absolutely need to be built up in this community do not have the admin capacity to have a solid HR process or a person managing HR. They don't have a lot of depth of financial capacity or even financial or fiscal literacy around how to run an organization like that. So there's so much to be talked about with the capacity piece on the number of beds. What's also interesting is that as we're putting more shelter beds in activation, which we do absolutely need, that the city has certainly been making some progress on with the safe sleep sites that they kind of created, I guess, almost a year ago now. And with other projects. We are slowly adding capacity into the shelter system. That said, we certainly are seeing a place where additional shelters, as we're adding them, it's a lot harder for the county to secure a provider and the city to secure a provider to operate these different shelter areas. And so that's one reason why the amount of time it takes to add shelter beds takes a while. And even when we have the facility, moving in the program is also really challenging right now. So this is another place, though, I do see opportunity for further collaboration, for that depth of collaboration to reach new heights. How about? I don't know if depths and heights can work together, but let's imagine a world. And that, I think, will also help us to get to a place where we're better able to manage / support people with a wide variety of different kinds of needs and desires to get into housing.
And I do want to remind everyone, shelter and permanent supportive housing is 2 different things. One is maybe the end result, but shelter is that emergency part when we say the word shelter. I just want to make sure our definition is there. We have about 5 minutes to go, so I think we have space for at least one more question, depending on how long we'd answer.
Thank you. My name is John Belcher, City Club member. First of all, thanks for being here and thanks for all you're doing. My question is one of perception and reception. Our community, in my perception, has been very negative about programs such as yours, especially when they're located in neighborhoods. That seems to have changed in this community over the past year or two. But now I'm starting to see compassion fatigue, especially in the Jefferson Westside neighborhood and the Whitaker. I'm curious, have you noticed that and how has that affected your programs?
Yes. Yes, I think in some ways COVID gave us opportunity to do things a little faster. We had extra money to do things that from the federal, with the CARES Act and such. I think everyone at the beginning of any disasters, rah, rah, let's come together, let's solve things. We're exhausted. Y'all are, whoops, my y'alls came out. Comes out every once in a while. You're exhausted too. Neighborhoods are exhausted. This is not a quick fix. Now, ideally, I would like to be out of a job. Ideally, I'd like to have a plan that would fix this quickly. This is systemic. This is long-term. This is going to require everyone working together. And yes, we are exhausted. So I think my call to action is, one, educate yourselves, educate your neighbors, offer kindness, assume positive intent. That's what I always tell my staff as well, is assume positive intent that someone's not trying to make a barrier. But find a way that you can work together, and we'll try to assume positive intent too.
You know, John, I think part of the reason why affordable housing is being embraced in neighborhoods is because of leaders like you, quite honestly. You've always been just super thoughtful, and that doesn't mean you haven't asked, like Homes for Good as an affordable housing provider, to do things differently or maybe design a building differently, but you've always been a leader in that space. I would also say the Jefferson Westside neighborhood did have an issue with the homeless encampments historically, and you know, it became exacerbated recently. At the same time, that neighborhood is like in love with affordable housing and promoting affordable housing in a way that I think is outstanding, and I'm incredibly thankful for them. We have to remember the reason why there's so much visible homelessness in our community is because housing at all levels hasn't been built to the scale that it needs to accommodate all the people that are moving into Oregon, because it's awesome here. And we've referenced it, but I want to say it more directly. There needs to be a publicly funded shelter in our community to house people experiencing homelessness. It is absolutely essential, and we don't have one yet. Now, I know the city of Eugene and Lane County are going to deliver on, but quite frankly, we should have had it many years ago. And many other communities in the Pacific Northwest also don't have publicly funded shelters, and they need to get with the program and place one in the community.
I couldn't resist, so here I am, Kitty Fiercey. So I just want to add to that and say that we have a history in our community where people were questioning whether you should go for housing or you should go for shelter, and we need both, and we need both all the time. So the question I really want to come forward with you about is, I believe this country has not taken this issue seriously. I do not believe the federal government has seen this as an emergency in this nation, not just in Eugene, not just in Lane County, but all over this country. People are falling through the cracks. And until we all, and that's us as elected bodies, that's us as states, that's us as people all over this country, unless we tell our government that they got to see this as a #1 emergency in our country, that children don't have homes, that we don't have the things we need for people to thrive. We are quickly becoming a third world country. And this is a terrible situation. So I heard what you said, and I know it's not a short-term thing, but I don't even think you can take it as a long-term possibility to solve this if you can't get your federal government to say this is a #1 priority for the United States of America? Your comments.
Thank you.
I just wanted to acknowledge Mayor Piercy's passion and commitment for many years to the houselessness crisis. She and Commissioner Farr housed more than 400 homeless veterans. That's just one of the many projects she's worked on. She still serves on the Square One Villages Board. They just opened up a new site. She was there. So I see Dan's in the room. But I mean, Mayor Piercy is right. That is what we need to do. We need to make sure the federal government is acting. We need to also act locally. And Jacob, you're right. We need a shelter, and we need to figure out how to do it. There's a lot of really incredible people who are working on it. So Rai, you're one of the leaders on that effort, so you might have something to add.
That shelter will open on July 1st, 2022. No matter what happens, it's happening. So if I have to personally go there and open it up for the first night, it's happening. So we're doing this. It's a thing. I also do want to say, in response to your comments, Mayor Piercy, a PG-13 response. It's hell yes. Thank you. Yeah, for sure.
I believe, are you here to tell me we have 1 minute?
No, I'm here to ask you one quick question.
Okay.
But everybody doesn't have to answer. We hear a lot about siloing, that we get so good about our own work, and so accountability, let's put a good face on it. In your own experience of your own work, what is something you've had to learn to do differently to protect your own boundaries less and create a better working environment for others, to work with others?
Hello. It's Sarai again. I can't stop talking. I love it too much. Here's mine. I started working for a local government 2 years ago, and that's my first time I've ever worked for a public agency. I've been an entrepreneur. I've worked a lot with nonprofits, and literally the amount of time it takes for things to happen is so much longer than I think it should take. And so honestly, a big part of what I have learned to do in the last couple of years is balance that sense of urgency and immediacy with the reality of stuff's still going to take some time, and that's just how it's going to be. That said, I think we can speed it up, and I think we can do better, but that's a big one.
I don't know if this is personal as much as something that is a challenge for social workers in general. And it's having those boundaries because and maybe it's, if you're a parent and you see your child and they're slow and you're like, I could do it faster myself. We can't do that with the people we serve. We have to make sure we're there to support, but not do for. And you want to make everyone better. You want to make everybody faster. And that's that time again, is that some people need more time. Some people need to fail a couple of times before they figure it out. They'll learn better. And so from a social worker standpoint, letting people take their time, not getting in the way to do it for them, and I think in some ways COVID has really made it clear we have to do that even more.
I'd just quickly offer, I think it's really about, for our organization, asking our nonprofit partners, how we can change our systems to be in service to people most marginalized in our community. So that's a big part of it. I honestly think the other part of it is partnering with the private sector, and I just want to give a shout out to Brittany Quick-Warner for her work in learning about the ending homelessness space and how we can do things differently as a community. I really think partnering with the business community is part of the solution, and just want to thank the Chamber for their engagement, and also thank people like Brian Obie, who partnered with Homes for Good on mixed-use development in the Market District, where homeless veterans have been provided a home among service workers and other people in the community.
And I can just say that from Trillium's standpoint, we were the sole provider of the Oregon Health Plan in this community. Pacific Source joined us as the second CCO in 2020. And we can look at each other as competitors, or we can look at each other as opportunities for collaboration. And that's what we've chosen to do.
Very quick.
Nope.
You done?
Well, no, but
Okay.
thank you, Kitty.
Okay, so let's give them a hand for, thank you very much. This has been our January 28th, 2022 program, collaborating on permanent housing solutions. Before we thank our speakers today, I'd like to recognize our diamond sponsors. That's my job. Kaiser Permanente exists to provide high-quality, affordable healthcare services and to improve the health of our members and the communities we serve. More information is available at www.kp.org. The University of Oregon has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically since 1876. Get more information at uoregon.edu. Peace Health. Peace Health has been proud to serve Eugene, Lane County, and beyond as your hometown healthcare partner for more than 80 years. The Peace Health mission is to keep you and your family healthy. Learn more at peacehealth.org. Lane Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, visit lanecc.edu. We are also grateful for generous support from the City of Eugene and from Lane County. I would like to acknowledge our Sapphire sponsor, Summit Bank, your local community bank, an independent community bank headquartered in Eugene. Summit Bank serves businesses and professionals, my mouth is not working well, in Eugene, Springfield, and Central Oregon communities. For more information, visit sbko.bank. Today's gold sponsors are Pacific Cascade Federal Credit Union and Lavas Cobb. Thank you to our in-kind sponsors, KRVM 91.9 Radio, PAC Info and Simplified Computing LLC, Dotson's Photography, and a special thank you to public radio station KLCC FM 89.7 for airing City Club programs on Mondays at 7. We invite everyone, members and non-members, all of you at home, to participate in our programs in person at our new venue, the First United Methodist Church at 1376 Olive, or by live stream on our YouTube page. More information is on our website, cityclubofeugene.org. Next week, what's coming? Something interesting. The program is Should Nuclear Be Part of the New Energy Future? Please join us again on February 3rd for more adventures in learning. I would like to thank today's speaker, Michelle Hankis, Debbie Farr, Jacob Fox, Sarai Johnson, for their collaboration and a great program. Thank you so much. Everybody, take really good care of yourselves and join us again next week. Thank you.